I can't imagine what that feels like for the patient. Because if you've got a patient on your table with what we commonly refer to as like a hot low back, meaning they're pretty flared up, their disc is on fire or their disc is hitting that nerve, causing them to have a lot of pain. They can barely move. Any type of they can't get comfortable. They can't relax, which is what she said earlier. She can't relax. She can't relax her leg because her back is hurting so much. Just getting those types of patients in a position where you can at least attempt an adjustment can sometimes be a struggle. Much less getting them on the table and slapping the crap out of their back right on the spot where their source of pain is.